Now, still on our imaging basics, we get to look at another imaging substance. That's like a contrast substance that is used in imaging. So of course it's used in imaging so that what it can give you a better outlook of the things that are of importance to you. All right, so we'll talk about this. I'll also talk about when it will be important to use what an indium 111 labeled leukocytes. Okay, so what we have here is this, so indium labeled leukocyte, commonly known as what the indium 101 oxine labeled white blood cells, they are diagnostic what radiopharmaceutical substances. So they are used in nuclear medicine, and they help to now what they will pinpoint where there's an inflammation. So here you can see that what there's inflammation in the liver, there's inflammation in what in the spleen. Okay, then there's some 1 or 2 inflammation here. There's around the pelvis. Here too you see that it's kind of like downward, maybe the intestines or appendix. You understand that kind of thing. So they help you to pinpoint on the imaging where there's what inflammation. So they work by tagging what a patient's white blood cells. That's you tag the patient's white blood cells with radioisotope what indium 111. So this can easily be tracked when you use a gamma camera. So radionuclide compound, so indium 111 is what a gamma emitting what radioisotope. It has a half-life of 2.8 days. So if you put it in a patient, maybe if you didn't get the result before you could actually go again, you leave after 3 days. Okay, so labeling agent is the indium 111. Is combined with oxine, which allows it to now penetrate and bind toward white blood cells. Okay, so I'm coming. So moving forward, we said that the patient's white blood cells are extracted, labeled with indium 111 and re-injected. So those cells, they migrate naturally to any site where there's infection or inflammation. Why? Because white blood cells are always going to where there's infection and inflammation to protect you. They are part of the immune system. So that's the basics of this imaging, using the normal biology of the body to actually get issues solved. So clinical uses is they can use it to dictate occult infections. Okay, if there's an infection and the origin is unknown, you have to just go through this. Localization of abscesses, know the exact place where there's an abscess, evaluation of inflammatory bowel disease, assessment of what prosthetic joint infections, then differentiating it between what an infection or an inflammation. So this is summary. Okay, trying to look at the properties, the half-life, the radiation type, gamma emission, labeling compound, they combine it with oxine, administration is what through the veins, then the type of imaging type that you tool you use. You can use the spectrum, okay, emission, and all of that, or you can use the gamma camera. Okay, so safety and limitations is radiation dose should be moderate. Okay, they are usually safe. Risks, handling blood outside the body carries infection risk, so everything should be so neat. Okay, limitation is time consuming. Okay, so if a patient is critically ill and you need what result now, you can't go for this. So alternatives, you can use a technetium 99 labeled white blood cells.